have just received the AED. To power on, open the case or the top of the AED. The included pads will be attached to the patient's bare chest. The pads will have a diagram to indicate proper placement. Some AEDs will have pads specifically for an adult and child. Adult pads should be used on anyone 8 years of age or older. The child pad should only be used on someone less than 8 years of age. If the age is unknown, use the adult pads to ensure enough power is provided. Never use child pads on anyone over 8 years of age or 55 pounds in weight. Now, place the pads on the patient according to the diagram on each pad. The pads are usually placed to the side of the left breastplate and below the right collarbone, or placed between the ribs near the sternum and between the shoulder blades on the back. Always remember to follow the placement pictured on the diagram for the AED you're using. Depending on the AED being used, it may start analyzing the heart rhythm automatically. If not, press the button to prompt it to begin analyzation.
Adult patient.
Once done analyzing, the AED will prompt if a shock should be delivered. At this point, all persons should be prompted to step away from the patient. Ensure that no one is touching the patient. Press the button on the AED to deliver the shock. The shock may cause contractions in the patient. After the shock, continue CPR immediately, starting with chest compressions. Do not power down the AED or remove the pads. The analyzation process will repeat about every 2 minutes. Once the device advises not to provide a shock, continue performing chest compressions. Now, let's review all the steps we've just covered using a real-time example.
Adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest. Remove packet and apply pads onto patient's bare skin. Apply pads as shown in the pictures. Remove packet and apply pads onto patient's bare skin. Apply pads as shown. Press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear. Press the flashing shock button. Shock delivered. Begin CPR. Ten. 20. 30. Give 2 breaths. 10. 20. 30. 30. Give 2 breaths. Adult patient. If the patient is a child, press the child button. Child patient. Remove the child's shirt. Remove packet and apply pads onto child's bare skin. Apply pads to child's back and chest as shown in the pictures. Remove packet and apply pads onto child. Press pads firmly on skin. Apply pads to child's back and chest as shown in the pictures. Press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm. Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear. Press the flashing shock button. Press. Shock delivered. Begin CPR. 10. 20. 30. Give 2 breaths. 10. 20. 30. Give 2 breaths.